Thank you for the opportunity to testify. My name is B. Moorhead. I'm the director of Texas Impact, which is a 45-year-old interfaith organization that represents the commonly held social concerns of Abrahamic and other religious traditions in Texas. Texas Impact has been a longtime advocate for increased access to affordable health insurance, and we've been an unfailing supporter of the ACA. We're hopeful that Texas will move quickly and effectively to implement and promote every aspect of the ACA, but I especially want to talk about the Medicaid expansion today. You have a copy of Texas Impact's op-ed that was published in a number of Texas newspapers in March, so I'm not going to read it to you, but to summarize, more than 60 religious denominations and organizations across the country, including Texas Impact, submitted an amicus brief to the U.S. Supreme Court in support of the Medicaid expansion. The religious brief highlighted biblical teachings regarding treatment of the poor. Teachings regarding the moral imperative to aid the poor and needy are consistent, persistent threads running through Judaism, Christianity, Islam, and other world religions, and they're addressed not only to individuals, but also to societies and governments. Addressing the failure of Israel's government, the prophet Ezekiel made his accusation, "You haven't strengthened the weak, you have not healed the sick, you've not bound up the injured." Over Medicaid's history, Texas has had many opportunities to expand or not expand programs or take advantage of particular features. And we don't always maximize our participation in Medicaid. But the general theme of Medicaid in Texas has been to claim dollars we deserve every time we can to help support our state's healthcare infrastructure. We have a big population, and I guess lawmakers feel it makes sense to use whatever tools are at their disposal to meet our community's needs. We have known most of you for quite a while, and we're grateful that we have such a wealth of expertise and commitment to the health system. And we know that one of the most challenging aspects of your work are the intense feelings that Texans have about the issues around the ACA. We know that there are levels of distrust and even animosity present here inside the Capitol and out in all of your districts, and all of them you have to balance with the need for all the other real solutions to real problems that represent competing priorities and competing demands on your attention. We want to support your work however we can, and what I want to tell you is we're working to convince people of faith in Texas that the best public policies are the result of mutual understanding and respectful communication. We hope that will be beneficial to the legislative process, and we hope you'll let us know how we can help you as you go forward.
Wow.
So thank you.
That is so nice to hear. Somebody come up and commiserate a little bit. Because, I said this at the beginning, but ultimately we all want the same thing, and it's a healthcare system that works for Texas. And yes, there are competing interests, but it's so nice to hear.